Welcome to the Weekly Dosage. This week, we'll be talking about waste and disposal containers in the pharmacy. What makes sharps different from Stericycle? What difference is there between the Stericycle colors? Why do we have so many types of hazardous disposal containers? What should you be looking out for when you waste a narcotic? Why can't we throw everything in the same container? And what just belongs in the trash? Today, we'll find out. Why don't we get the red sharps container out of the way first? Here in the pharmacy, since we don't deal with biohazard products, the only thing that we're utilizing the red sharps container for are empty syringes and needles. Empty syringes can come from sterile or non-sterile compounding and from IV or oral use. What we're never disposing of in a red sharps container is our leftover PPE, trash, or vials, bags, and syringes with remaining medication in them. Spoilers, those have their own Stericycle containers, and we'll talk more about those later. There is one medication exception, and that has to do with blood products. So if we're compounding something like albumin, IVIG, or a factor, any devices or tubing used in the compounding of these products, as well as any remaining medication left over in the original container, will get disposed of in the red sharps. This also means any return products that have been transferred outside of the manufacturer container will get disposed of in the red sharps as well. For the last thing that gets disposed of in red sharps are empty ampules. Let's take this time to remember what we're not throwing in the sharps as we move on to the purple containers. The purple Stericycle container is the primary disposal container for all syringes containing medication. This goes for both IV and oral medications. These purple bins are sharps approved, but that doesn't make it interchangeable with the red sharps container because the purple bins are exclusively for medication containing syringes. This just means if you have a needle still attached to your syringe while compounding and there's leftover medication in it, you would use the purple Stericycle. It also means if you have an ampule with remaining medication in it, you can throw it out in the purple Stericycle as well. So just remember, if you're using purple Stericycle, this bin is for syringes only. The blue Stericycle containers can almost be considered the default waste container because 94% of pharmaceutical waste belongs in this bin. It's used to dispose of any non-coded medication, and this includes medications left over in an IV bag, vial, as well as any in-house pre-packed medication that may be expired or damaged. A number of bulk products are also disposed of in the blue Stericycle container. This means things like topical ointments and creams, eye and ear drops, or loose medications returned to the pharmacy because they haven't been pre-packed will also get disposed of in this blue bin. While we know sharps and syringes that contain medications have their own bins, we haven't discussed what a coded medication is and why it belongs in its own container. This begins the confusion about what all these hazardous disposal containers are for and what makes them different. First, we need to define what hazardous is in the context of what we are disposing of. When it comes to the black containers and the yellow containers, there is a big difference. The government's regulation of commercially available products that are hazardous to the environment requires certain disposal conditions, how they're transported, and where they can be disposed of. What we use the black disposal containers for is just a small glimpse into a greater list of hazardous chemicals or products. That's why there's a number of black disposal containers, each with its own list of products that we carry that requires different disposal conditions to meet these regulations. This differs from the yellow containers because what we in pharmacy consider hazardous differs in terminology because that's a consideration for occupational hazard. Occupational hazard medications, what we consider high or low risk drugs, get disposed of in the yellow bins for our safety. The black bins are disposal not because of occupational hazards, but because of environmental hazards. For our purposes, it's easy to spot an occupational hazard drug because our labeling is different. That's why when it comes to medications that need to be disposed of in the black containers, we refer to different lists. You may be most familiar with this list, and it's been specially compiled by Stericycle for us based on our most used medications that qualify to be disposed of in this black or BKC container. But there are a number of different black containers that we use to dispose of different types of products. These 4 black Stericycle containers are used much less frequently, and of the 4 in the pharmacy, our major use is basically for the SP black container because that's where aerosols and inhalations get disposed of. In med rooms, on the units, you're most likely to see the SPC container because that's where TPNs are disposed of. Because tubing follows the bag, they can get pretty full pretty quick, but they should still never look like this. This is the final container used to dispose of coated medication. And this little white bin is only for disposal of these 3 products and its packaging. One of the most incorrectly disposed of drugs actually belongs in the black container. Do you know what it is? It's insulin products. We have 2 types of containers that we use to dispose of occupationally hazardous drugs. First, the trash cans in the HD rooms are lined with the special yellow waste bag. As long as a trash can has this trash bag in it, we can dispose of all of our hazardous PPE, hazardous trash, solid HD waste, and bagged IVs of HD drugs. The second container used has a much more limited scope. That's because it's a yellow sharps container. All syringes, needles, tubing, or other devices used during compounding of HD drugs can get disposed of in the yellow sharps container, as well as any vials that have any medication remaining in them during compounding. All HD drugs in a syringe that get returned to pharmacy also get disposed of inside the yellow sharps container. Think of it as a mix of red sharps and the purple Stericycle, but for HD drugs only. Proper disposal means that you remove any labeling and also remove it from the transport bag that it got returned in. Those belong in the previous waste container, the properly lined trash cans. The only thing that should go in the yellow sharps container upon a return is the syringe of HD drug alone. We also have a special disposal container made only for controlled substance waste. Whatever gets deposited in this container must be documented with a witness. For example, during IV compounding, any overflow left in a vial would be documented on a triplicate and wasted together with the pharmacist into this container. If it's an IV, everything gets pushed out of the syringe into this bucket, and the remaining syringe would go right into the red sharps container. That means no packaging gets disposed of in this container. It's literally the controlled substance alone. Some things aren't considered pharmaceutical waste at all. So solutions and electrolytes can go down the drain as long as no medication is added. That means your bases like dextrose, saline, and lactated ringers, and the electrolytes such as calciums, magnesiums, potassium, and sodium bicarb can just get flushed down the drain. Cut open your bag and run the water and just let it go. After you're finished, just throw the bag out in regular trash. Bags and vials that have been emptied of medication during regular compounding can just get thrown out in regular trash. It's now considered non-pharmaceutical waste. Only when there's remaining drug left over in either does it need to go in the blue Stericycle containers. Vial spikes, bag glaives, and tubing that's been disconnected from bags are also considered non-pharmaceutical waste. Bags that have been used to transport medication, as well as PPE used during regular compounding, are both just regular trash. Expired products that can be returned by our purchaser go in this bin. And our final disposal container is for HIPAA. Any labeling that has patient information on it is going to go in these Iron Mountain bins. Next time you have a bin full of returns from a medroom suite or a discharged patient, you'll know what bin to use. And a quick glance in the bucket, you'll be able to tell at a glance what belongs in these bins and what definitely doesn't.